Hi guys, Dr. Lauren here again with Caledon East Chiropractic. Today we're going to run through how to manage a kink in your neck or acute neck pain, something you woke up with, often kind of pinching in the back somewhere, really hurts, you try to turn your head, perhaps you're locked, nothing's moving. Keep in mind these tips, kind of what I'm going to walk through is outside of an acute trauma. You didn't fall and hit your head, you didn't kind of pull your neck playing a sport, going to the gym. This is kind of just a kink in the neck you woke up with. Tends to happen on weekends, holidays, in between appointments, but you just can't get in, but you're trying to manage at home. Let's walk through ways you can try to help yourself before you get to the appointment. So disclaimer, neck pain, headache can come from a multitude of different reasons. We're always looking for those kind of red flaggy, yellow flaggy ones where like, this looks like something more than just a kink in the neck. So things like a sudden worsening headache, worse than you've ever had before. Dizziness, blurry vision, numbness on the side of your face, arm, or half of your body, difficulty talking, swallowing, speaking, things like that. Nausea that's come out of nowhere, especially if that leads to vomiting. These are signs, or could be signs, that perhaps your neck pain and headache is a little more than just a tight muscle or a pinch in a joint. If that's the case, if you have any questions, please reach out to your trusted healthcare provider or simply go get care in an acute clinic or the hospital. So in terms of this video, let's talk about you woke up with a kink in your neck. I don't know what to do before my appointment. Nothing's working. Help me out. Let's walk through it. Let's walk through my do's and don'ts. The do's first. The often debate, heat versus ice. What are we trying first? In acute cases, when you don't know what's going on, is it a pinched joint? Is it a sore muscle? Is it a nerve that's being irritated? I always err on the side of ice first for those first few days, or at least first few hours. In case it is a nerve, they tend to not like heat to the area. Think of like adding wood to the fire. So ice intermittently, so a little bit on, a little bit off for that first day or two may help soothe symptoms. If the ice doesn't work, try the heat. It's not the end of the world. Movement is our big one. Something as simple as a towel can go a long way. I know when things are tight and pinched, you don't want to move at all, but movement really is like motion is lotion here. So something simple like little easy neck circles, they don't have to be big. It just has to be a movement of some kind. I like to use the towel trick. You often find yourself unable to bend to the side, twist, even look up sometimes. This little towel, hooking it behind our neck, kind of hugs the back of the neck, adds a bit of support there. All we're doing is pulling the towel forward, kind of hugs the back of my spine. Now I have that little ability to tip backwards. We come forward, we come backwards. You can even do the same thing to turn. So again, I'm kind of leading it with the towel. As I turn, just a little extra support helps calm those muscles down that have kind of jacked up to protect that pinched facet joint in the spine. So here's another option. Diaphragm breathing is huge. So this is belly breathing, not shoulder breathing. Oftentimes when we're in acute pain, we kind of breathe through our shoulders because everything hurts. I really want you to focus on breathing through your tummy, not your chest. So that's a deep breath in. Look at expanding your belly out, sticking your belly out, not seeing your shoulders, raise and lower there. Options too, you can always get someone at home to kind of gently massage the area. Different lotions and creams can help that way. If you're looking for over-the-counter pain relief, I always recommend reaching out to your either local pharmacist or family doctor for that. They're best at prescribing what's the best for you. Perhaps you're on certain things that they don't want you taking certain pain relievers, kind of what fits your best scenario. So let's talk about the don'ts, things we're avoiding at all costs. Okay, so let's run through don'ts. So I kind of alluded to this earlier when we talked about we want movement, we want things like that. What we don't want is immobilizing. So being very stiff, not moving, laying on the couch or your bed for too long, giving things the opportunity to tighten up and lock up makes our job more difficult as a therapist to help you later when things are really kind of hampered down, but also more uncomfortable for you. With that being said, things like braces, collars, stuff like that, please leave them off. We don't need them. Unless you've been told by an acute care physician you've had an acute injury, they're concerned about stability of the neck, leave them off. That's their window of use. Other than that, they're not useful. We talked about stretching and movement. So with that, stretching in terms of pulling and holding things, pulling into pain, yanking on those muscles, stressing those joints, it often doesn't like that in those first few days. Let's err on the side of small, gentle movement rather than stretching. Stretching is something we can approach later. It's often uncomfortable. We never want to stretch into sharp pain. That may cause things to radiate or worsen. So All that being said, hopefully that gets you through your acute neck pain. So sorry you're having it, but come see us or come see your trusted healthcare provider, and we'll get you feeling better soon. Take care.